All right, welcome back to the No Morning Show here on TTT. We do have on telephone with us this morning Technical Director of Epidemiology in the Ministry of Health, Dr. Avery Hines, to just talk to us about this uptick that we've been having in numbers and just what we need to do individually and collectively to get those numbers back down. Good morning to you, Dr. Hines.
Good morning. Good morning, and thank you for having me.
Thank you so much for joining us. So yesterday, 233 cases, and for the first time in Trinidad and Tobago, 8 deaths in one day. What really has changed?
So the thing is that nothing has changed. What we've been seeing is the outbreak moving along that same sort of path, that same trajectory, going in the same direction that we've been speaking about for the last few weeks, where any infectious disease outbreak does exactly this. When it starts to surge upwards, when it starts to trend upwards, you see larger and larger numbers affecting the population. And with that, you may have increasing levels of undetected infection. People who don't know they're ill and they're passing illness to other individuals. So you are seeing a lot of people reporting that they don't know who they got ill from. They don't know when they would have been exposed to someone who was ill. And what you have is a wide section of the population actually having infection, and a large number of those people would be in the susceptible age groups or have susceptibilities that they don't know about. They have susceptibilities that have nothing to do with the age group. So
Right.
you have younger people that are actually unaware of pre-existing comorbidities. They have some young people who didn't have any comorbidities listed, but as the virus goes through the population and the largest segment of the population is exposed, you have the sequel of deaths, because that's what this virus does. That's one of the things that has us concerned about the virus, the fact that there are a percentage of individuals who will die as a result of exposure. And the more people there are in the population that are ill, whether they know it or not, the larger that number of people who could have an adverse outcome will be. So we're seeing those numbers looking higher now because of the number of people in the population who are carrying the infection, known or unknown, symptomatic or asymptomatic.
Right. Dr. Hines, we saw for the Christmas season, which is normally a very busy season and a lot of meeting and greeting, that the numbers were very controlled. Why weren't we able to enjoy that kind of, reprieve for the Easter season?
Well, it would appear, although we can't say for certain, it would appear that there was definitely a lot less mixing and moving at the Christmas season than there was at the Easter season. We don't have numbers for the Christmas season to indicate how many people would have mixed, moved, etc. But for the Easter season, we did see where I think the Ministry of Transport indicated at least a number of people that moved back and forth just between Trinidad and Tobago, and that's not the majority or even the important part of the movement. It's all the movement in country, on island, all the gatherings that people would have had, all the places they would have gone. There seemed to be a lot more mobility and interaction over that Easter period than there may have been for the corresponding Christmas period, at least if we look at the impact on the spread of the virus. And it's not just the mobility, of course, it's what we're doing when we move. So if with our movements, we aren't really strictly adhering to all of the precautions that allow us to reduce the risk of spread, then there's always going to be a probability that somebody who's ill can transmit illness to somebody who is not.
From
The
a
more
medical
of that
perspective,
happens,
Dr. Hines, did we roll back the measures too quickly? Because up to December, we would not have been having, I think we would not have been having at that time, in-house dining, we would not have been having contact sports, that kind of stuff. Did we roll back too quickly?
no, we wouldn't. I don't think you can say that we roll back too quickly. And the reason for that is that you can't leave measures in place indefinitely. At the point in time when measures are rolled back, they roll back on the basis of the situation in the population at that point in time. And when they roll back with the caveat that we need to maintain certain kinds of behavior in order to keep the numbers low. And for some time, we did see that the numbers remained quite low. They got lower from January into February. February was the lowest that they'd been, even after the little for want of a better word, pseudo carnivals, little gatherings that we know would have taken place, the numbers still remained low-ish. And
Right.
then, as viruses do, this virus in particular, as it does, it began to rise at first slowly, and then you started to see it pick up pace. And as it did that, measures were then put back into place with the objective of preventing people from being able to spread virus to others. The most important thing that we can do with this particular virus is keep in mind that we don't know who could be ill and asymptomatic, and therefore we need to behave as though these measures are life-saving at all points in time, wherever we go and wherever we interact. And one of those important measures that I think people are beginning to get a little tired of is the mask wearing, because that really does help with the reduction of viral spread from people who don't know that they're ill and therefore they're still out and about. It helps with the reduction of the viral spread in indoor settings where people are exhaling into air that is then being recirculated. With the mask on, the reduction in risk is significant. And that mask wearing is one of the things that helps even in the face of what we're now seeing with the CDCs speaking about the role of airborne transmission in addition to droplet transmission as a factor. That airborne transmission that we're seeing, where they're saying droplets or even smaller particles, aerosol particles, can hang around for a while. That's what the mask wearing is designed to help us to reduce, not eliminate completely, but definitely
So
reduce,
then where are
and
we
therefore increase the
having
safety in an indoor environment.
where are we having this uptick then? Because the mask wearing has been implemented since last year, March, I think, or February. We're over a year into this. We know what we need to do. Why are we seeing these really outrageous numbers in terms of the amount of positive cases that we're having? And as you said, as a result of the increased numbers, increased deaths.
So what we're seeing right now is that a lot of these situations or the environments in which people are aware that they may have been infected are in fact some of the workplace environments where people would have come to work, they came to work not feeling so well, or they came to work and then began not to feel well. So if they felt well at the start of the day, got to work, and then began not to feel well, not much you can do about that. The ones who came to work feeling unwell, again, this is one of the things we want to discourage. Because when you come to work and you know you're unwell, then you are exposing people, not intentionally, but you're exposing them even with the knowledge that you weren't well, you shouldn't be in the office. So that was one of the places. Clearly, in the household, we saw a lot of house to house, or sorry, rather within household, person to person transmission. And again, the guidelines on how to isolate yourself in your home if you feel unwell. We know it's not the natural thing, but these are things that will help to reduce that particular risk. There are things that can be done to
Dr.
reduce the
Hines,
risk even in the household.
we do have restrictions in place. We had them before. We have even tighter restrictions now that the Prime Minister and the team announced up to it was Thursday. But how long do you think it will take for us to start seeing the numbers trending downwards?
So some of the more stringent restrictions are still less than 2 weeks old. The most stringent of them that would have been implemented around the 29th when we started to close off the not just the in-house dining, but also the takeaway, etc. All of those restrictions from the 29th come forward are still under 2 weeks old, and we usually start to see the impact of these sorts of restrictions from about 10 to 14 days out.
So
So
the
we're
question
hoping that
is,
around now,
the
this is the
question is,
time frame
Dr.
when you start
Hines,
to see the corner start to turn.
is the parallel healthcare system able to manage the cases until we start seeing, that downward trend in the numbers?
So the parallel healthcare system is in continual build and expand and adjust mode, so that as the numbers change, as the occupancy rises, there are contingencies that are put into place and rolled into play to accommodate for the rising numbers. Now, again, because the system is finite, you can't expand the system indefinitely and infinitely. But at this point in time, with the contingencies that are being put into place, yes, the parallel healthcare system is hoping to be able to keep pace with the numbers until they begin to drop.
My final question to you, Dr. Hines, is that 2 weeks' time, let's say we get those numbers down. The reality is that once we can say now that once we ease the restrictions, the numbers go back up. So is this the cycle that will continue until we get vaccinated?
So here's the thing. It's not just that once we ease the restrictions, the numbers go back up. It's once we ease the preventive behaviors. So there are two levels of prevention. There is the individual action and there's mass action. The restrictions are mass action preventive measures that keep people out of circulation, out of contact with each other to drop numbers. Once the numbers get back to manageable levels, what keeps the brake on is that individual action. So as we saw from December come all the way forward, individual actions would have been in play before fatigue set in, and that kept the numbers down even without the restrictions. But once fatigue sets in and behaviors change, once there's mass gathering of any kind, you see that creates a bump in the numbers. So we're really going to have to manage that aspect of it if we want to keep the numbers down in the absence of restrictions. So restrictions are a heavy brake, and then the individual responsibility of following the guidelines is what keeps you at a manageable pace thereafter.
All right, Dr. Hines, thank you so much for sharing with us this morning.
Okay, thank you for having me.
Dr. Avery Hines, Technical Director of Epidemiology, talking to us there. And you notice the difference? There's a difference between the mass restrictions and individual responsibility, because the restrictions just restrict movement. But even if he was saying that in December, we didn't have that restriction of movement, but people were doing what they were supposed to, and therefore the numbers were still down. So let's hope we can get back there, because I don't want to dead. And I know you don't want to dead too. And I don't want to get sick either. I'm sick enough already, all right? Keep me safe, please, even if you don't want to keep yourself safe. All right, a break and we'll be back.